What's up, guys, and welcome back to the podcast. My name is Robbie Cassidy, and today we're going to discuss how we can use the internal focus or use an internal focus to help rehab an injury, rehab an issue, or to actually affect the physical or external. Now, when I look at the internal, really I'm looking at the psychological side of things. In the podcast I put out before, I was talking about how we can use the external, such as movement, maybe incorporating some of your senses to try and, I suppose, improve an injury or improve your internal state or your psychological state, because both of them actually come together. Now, anyone who has worked with me or anyone who follows me on Instagram will know that I'm big on working on the psychological aspect of it, because I think most often it's overlooked when it comes to physio and when it comes to rehab, is that we often just look at the external. We always look at the physical and we see what we can do to change the physical or how we can improve an injury by changing the physical. Okay? Now I'm going to jump between talking about injuries and I'm also going to talk about like life and how you can, I suppose, change your lifestyle by affecting the internal. Now, when we're looking at the internal, when we're looking at the psychological, this is an interesting one, and it crops up with a lot of people that I work with because many of them are struggling with the same injury or issue that's reoccurring. Now, as you know, if an injury is reoccurring, or if this maybe is your first podcast, a big part of the problem here is that if an injury is reoccurring, or if the same issue keeps flaring up, it's more of a nervous system issue than actually an acute or muscular issue. And that's why a lot of the time when you look at somebody who's having recurring knee problems, recurring back issues, or recurring shoulder issues, now it could be any joint, neck, a lot of the time when they get an MRI, the MRI is more, it's not as effective as you would think it would be. Now, the reason I say that is because it'll show you things that structurally may be changed, but that might have no effect on your pain. And you often see this with bulging discs. You often see it with degenerative disc disease. And you'll often, very, very often see it with things like a rotator cuff tear, which previously we would have thought that it's a muscle injury that's causing shoulder pain. But as they looked at the stats and they kind of looked at what populations were getting affected by this, they found that most people are over 40 years old, have rotator cuff tear. But if you look at people who have no shoulder pain and they still scan them, they're actually finding that a lot of these people as well have rotator cuff tears as well, or have tears in the rotator cuff muscles, or one of the muscles of the rotator cuff. So what does that mean? It means that, to me anyway, it means that there's a lot more going on than the physical issue there. Okay, and the MRI only highlights something. It'd be the same as going in, taking a photo and judging somebody's age by the colour of their hair or the amount of wrinkles that they have. You'd never ever say that someone has whatever grey hair, so they're more likely to have a shoulder injury, or that's where the shoulder pain is coming from. Although grey hair is a sign of obviously aging in a lot of cases. So I think that when you go to put these things on, when you go to like a doctor and if you're having a recurring issue or injury, and then they send you to get an MRI, a lot of the time what comes up in the MRI, the consultants or whoever's working with you will often go off of the results of that. Now, the climate is changing, that people are getting a better understanding that there's a lot more involved in it. And in this podcast, I want to talk through a few of the issues that could be also contributing to the pain that you're feeling, as well as how your body is reacting to the injuries and the pain that you're having. Now, the first one I'm going to look at is language. And before I start this off, I want to talk about a client I had, who I have been working with, who complained of a hip issue that was going on. Actually, it was more of like a hip lower back issue. It was difficult to differentiate, and it came out at different times at different places. Now, this guy had been struggling with issues for a long time, for years. And on one of the calls, I asked him, do you ever speak negatively of your body to other people or to yourself? And do you ever preempt pain? And his response was, at the time, he said, not that I've noticed, I obviously speak negative of my body to other people because I have injuries going on so long, and it just becomes part of the narrative, and which is completely understandable. But I said, I want you to go away for this week, and I want you to think about it, and I want you to become a small bit more aware of how your language is. Are you preempting things before they kick up? Now, when we jumped on a call a week later, we were talking through it, and I had my notes in front of me, and I highlighted. I said, "What was that like? Did you notice that your language, or that you were preempting anything before it even happened?" And he said it was a funny one because he noticed that when he got out of bed in the morning, he was saying things like, "Oh, my back." When he started walking around and he started going to the kitchen, he was talking about, "Oh, Jesus, it's the same again. It's no better than yesterday." And then even to the point that before he got on his bike, he was making the noise like he was preparing. He was taking an inhale, and he was kind of saying, "Oh," he was making noises before. I know, funny noises, sorry. But he was making noises before it even had happened. So he had been preempting that pain, which in turn affected his experience, in that his body actually started to give him pain when there wasn't an issue going on, because that's what it thought was going on. So the body was starting to react to that, and the nervous system was picking up on all these cues that there should be pain and there should be an injury here. The same as if you sprain an ankle, a lot of the time when you go to put the weight on it the first time, it's extremely sore. It's like a shocking pain. But as you walk on it more and you kind of get a better feel for it, it's sore in some positions, but it's generally, you're okay to walk on it and you're okay to put a small bit more weight on it, depending on obviously the severity of it. So just by highlighting this, he was able to make a huge change in the couple of weeks after that fact, because he was able to cut that, I guess, I don't know, is preemptation, is that even a word? But he was able to cut that off before it even happened. So instead of, when he was getting on his bike, instead of saying oof or ah or anything like that, or like inhaling, we just got him to relax. We got him to exhale and breathe slowly and think, I suppose, a bit more optimistically about it. And very soon after, the body started to follow. So the pain started to go away, which was a really interesting one for me. Now, to bring it back to a language perspective, if you are speaking negatively about your body or body part to people around you, now it can be in sport or otherwise, like a lot of injuries are blown, their severity is blown out of proportion because of the fact that people are very, very kind of like cautious, especially if it's an injury you've had a long time or it keeps recurring. And I know this myself because I've gotten caught with it with a couple of injuries before. And that you just kind of, you're nearly always just waiting for it to kick up. And then if someone asks you, oh, you're talking about excruciating pain, it's crippling pain, unbelievable, it's always there. I can't move. I can't even get out of bed in the morning. Now, think of that language and think of how it comes back to your body. First off, if someone says to me they can't do it, I will nearly always ask them to do it in front of me, like on the camera, or if I'm with them in person. Because the language that they use isn't exactly, what's the word? It's not realistic in a lot of cases, in that they might say, I can't get out of bed, but it just means that for the first couple of minutes they need to kind of get moving a small bit more, but then they can get out of bed and they can start walking around. Now, I know that's a small thing. When you're thinking, geez, like, why is he going after that point? You'd be surprised how this can get into your subconscious, and you can slowly but surely limit yourself in what you can do and what you think you can do. So another one I often hear is, I can't do lunges and I can't do squats. And anyone, if you're listening to this now, or I'm sure a few people that I work with are listening to this as well, they'll know well that if they tell me they can't do something, that's going to be up in the program in the next day or two. Or I might even get them to do it there and then. Because I love to go after those small limiting beliefs, because if you can notice, like if you notice the language you use and then you can make change in the moment right there, it's crazy to see how much confidence that gives people. Because a lot of the time, as I said, these are like internal, they're like subconscious narratives that they tell themselves. It's not realistic. It's not something that's happening. It might be, okay, if I do lunges, it's sore for the first couple, but it doesn't mean you can't do them. Okay? That's the important thing. Like a lot of people say, I can't run because my knee is hurting me. Well, is your tolerance now dropped to your knee? And when you even think about running, when you start running, or if you do light jogs, it gets very sore to start, which is so common. It does for a lot of people. There's no question. And pain is not exactly a very nice experience. But as you get into it, generally that pain starts to subside a small bit more. Okay? So the very first thing I would say is that you need to be careful with the language you use and the tone about how you talk about yourself. Are you optimistic or are you pessimistic about your body? If you're pessimistic about your body and what you can do, it will react that way. You will get more pain. You're going to be unable to do a lot more things. And even the next day after you do something, you can have fairly high levels of pain, even though there's no injury there. And it's more as it's the body's reaction to it. Because I think pain is such an interesting one. It's the things that go into pain and what dictates the pain that you have. I couldn't cover them all in this podcast. I've done other podcasts on it before to try get a better understanding of what it is, or to try give people a better understanding of what it is. So if you go back to like episode 4, I think, or 5, I have an episode on the pain experience, and that in that one I talk a lot about like what contributes to pain. And even since I did that episode, that's a couple of years ago, I've come to understand that a lot more things contribute to pain than I initially had thought, which is interesting. So really what it means is that pain itself is it's a lot more manageable, and it's a lot more like malleable, I suppose. Is that the word? Probably the wrong word. But you can play with your pain in a small way. Like you can dictate how much you have at different times. Not always, but at different times. Like if you break a leg, you're going to have a fairly significant amount of pain for a while after, and then slowly but surely it'll subside until you put pressure on the fracture and it'll start to kick up again. So what we need to do is we need to change. If somebody asks you, how are you doing? Or how is the pain? And this is important if you are talking to a practitioner, especially if you're talking to a consultant, because you're looking at surgery there, possibility of surgery or not. You need to use the right language. Now, I know the other thing is that, to not go on a tangent about it, but the other thing is that at a certain level, your ego will start to kick in as well. In that you'll be like, well, I'm here for a reason. I need to make this at least sound like I'm not wasting the other person's time. And I'm not wasting my own time. And you need to be careful that you don't get stuck in that mindset, because you will slowly but surely move yourself in a direction of surgical intervention if that is the case. And you'll move yourself into more of a negative outcome if that's the case. So for those listening to this, I want you to be careful about that, about how you talk about it. Using the words crippling is a dangerous one to use. Excruciating is like, I would say to people, is a pinch. If someone pinches you on the arm, is that an excruciating pain where they pinch really hard? It's not really excruciating. It's a lot of pain. It's fairly sore. But in general, it's not excruciating. It's bearable in a way. And the same thing goes for a lot of other pains that you feel. And the thing is, everybody who's listened to this has felt pain at some time or another in their life over something, whether it's a recurring injury or not. But once you have the knowledge that you are able to control that, and that you have an influence on it, that it becomes a lot more manageable. So I want you to be mindful of not using those words of you can't do something, you can't get out of bed. And in your head, and I'll talk about beliefs after, that may be a belief that you have, but it's something that will need to be cracked. So you changing the language that you use, using something like, oh, it's manageable, that's improving. And see, that's why it comes into tone of voice. Oh, it's improving, or oh, it's improving. It's getting better. I only have pain at times. It's annoying. That's completely different. And if you use those words, slowly but surely, you'll find that you'll take a lot more control over it. You'll have a lot more control over your body and what you can do. So I would say, first off, you need to really, really become mindful of the language you use when you talk about your body. And as I said, I've gotten stuck in this pattern multiple times for myself, like in that I've noticed like calf injury that kept on kicking up, and I just kept on building it up. And it's funny, especially when I was playing sports, because I wasn't able to play the sport, I had to align my belief of how severe the pain was, even though It was more that, okay, the pain is pretty high here. Like when I push it hard, there's definitely a tear there, no question. But I had to align my beliefs to what I felt it should be like or what other people would think it should be like. And that's the reason not playing. If I said to someone, how's the hamstring? Like they say, tore a hamstring, because I did fairly bad over the summer. How's the hamstring doing? It's manageable. It's all right. If I said, oh, it's horrible, I can't move, I can't get out of bed, I can't do anything, then they'd be like, oh, that's awful. But at the same time, I'll get a little pat in the back for myself, because it'd be like, yeah, that's the reason I can't do it. But when I noticed that, I started to change it to, oh, it's actually improving, it's getting better, still not there, but it's getting better. It hurts me with certain movements. If I try to speed up, if I try to really sprint, it feels me, but I can jog. Do you know, when you kind of focus on the things that you can do, that's huge. And that actually brings me on to the next point of what you focus on. Now, your focus is huge when you are rehabbing an issue or an injury, or when you're trying to change the external, because as I said, it might not be an injury there. It could just be that your body is reacting to that. So your threshold of pain is a lot lower. Now, if your focus is on the pain, you're going to notice that the pain is going to be through the roof. If all you think about is the pain all the time, and it's easy to get stuck in this mindset, because the pain is a very physical experience. You can feel it. Like, there's no two ways about it. It's sore, like, depending on the level. But if you really focus on it, the worse it will get. And an example of myself is that let's say I was training jiu-jitsu last week. I was in against a bigger guy. During the roll, came down on my shoulder wrong, and didn't really know. I noticed it, stopped, kind of rolled it out for a second. I knew I hadn't injured it. I knew it kind of just got jarred. Went on, continued on with the roll, was grand, did maybe 2 or 3 after that. And then when I got home, I was all right. Breathing was a small bit affected because I was feeling my rib was getting sore. And the next day, I was just sitting down, I was prodding and poking around it, and my rib got really, really sore, like really sore right on the spot. So I couldn't inhale. I felt, see the way I just said it there, I couldn't inhale. I could inhale, obviously, but it was difficult to inhale. That's funny the way even my own language there went back to that. You have to catch it. If you don't catch it, it's hard to change it. But anyway, as I focused on the pain more, the intensity of the pain increased massively. And instead, I made the decision that, okay, I know my rib isn't fractured. I know that it's just got a bit jarred. So I'm going to continue to work into it a small bit more with my breathing, try get back to a full inhale, see if I can start to do a few overhead movements, see if I can do rotations, stuff like that. Very soon after, as I started to focus on the functional side of things, what I could do, that pain started to decrease massively. And it was actually funny because it was nearly gone in a day. Like, I went to bed and I got up the next day, didn't think about it for the day, and I was just basically doing up this podcast, or kind of writing out this podcast or the notes for it, and I had noticed that it had gone down significantly, while the day before I couldn't inhale properly. So, did the injury fix overnight? No, it didn't. But my reaction to the injury did change overnight. And that had a huge effect on what I could do the next day. Now, if I press on the spot, or if I pressed hard in on it, I could feel it, because obviously there was a bit of inflammation there. I can still feel it now. And this is a good few days after. But the severity of that pain has gone down quite a bit. Now, if I wanted to, as an experiment, I'm sure I could get that pain up to the point that I find it very difficult to inhale again. And all I would have to do is press on it, start really shortening my breath, really think about the area, think about how bad it was, think about the injury and how it happened. And slowly but surely that will start to creep in again. Okay, and this is why it's dangerous, because if you get something like that, and let's say I go back training, then I get a bang into it again, and it flares up again. Now it's like, all right, I have to re-injure it. But I didn't re-injure it. My focus has returned back to it because it's gotten overused again. So, standard, when something gets overused, your body starts to protect it a small bit more. It gives you pain, gives you a bit of tightness, just so you don't use it as much, and you're more aware of it. And that should be enough. But if you start to really focus in on it, then it starts to kick up. So when you are looking at getting over these issues and injuries, it's important to not focus on the pain itself, but try to focus on the function and what you can do What you can do today versus yesterday. What you can do versus last week or the month before. Okay, this is, if you can get this into your head that you start to focus on the functional side of things and what you're actually able to do, you'll find that, okay, well, as I said, I was finding it difficult to do a full inhale, but now I'm actually able to get a full inhale with very minimal pain. Okay, that idea of changing your focus is huge. And if you combine that with the language of, okay, when you think about it, your focus is obviously on the area. How's that feeling? Oh, it's still really sore. Or actually, no, that's improving. That's getting better. That's a completely different experience then. And your body will react to that accordingly. Now, I'm not saying that you break a bone and then if you just had to focus on it, it'll heal faster. There's no question. It'll still take time to heal. I'm talking about the experience of pain that you're getting after that fact. Okay? And what you can do, what you limit yourself to do. That's really what I'm getting at here. So this is why when I'm talking about changing the internal or focusing on the internal to change the external will mean you'll have less pain and more function because your body won't be as protective of it while you're giving it a chance to heal. And with the extra movements that you're doing, that will improve circulation. And in time, you would hope that would help with the healing process. Okay, so what we're doing is we're trying to nearly turn off that pain response, not turn it off, but turn it down to a manageable level so that we can progress with our rehab. And instead of focusing on it when it starts to kick up again about how bad it is, focus on what we can do functionally and how we can improve it day by day after that. So language and focus are the first two. Now, the next one, this is a difficult one, and I actually got roasted when I was doing my masters for writing this down wrong. In that I was on a placement and I had said I was with a lady who was struggling with an issue but it wasn't, as you could see from her physical examination, that it wasn't as severe an injury as what she had considered it to be or thought it to be. But everything that was going on around her, she was really struggling to cope with it. So her pain was going through the roof. Now, and I basically put it down as not coping very well or something like that. And they weren't too pleased that I wrote that down. But anyway, I won't do it again. So I think in this case is when you look at coping is what's going on around you at the time. So if the pain is really high and you're finding you're not coping too well with the pain and what's going on, it's time to take a step back and look at what's going on around you, because there's a few things obviously contributing to that pain. Now it could be if you're looking at in a sporting situation, it could be that you want to get back for a certain game. And the fact that you got injured, everyone gets injured with different things, different times. It's how you respond to that and what your resilience is like and how you come back. But if there's a lot of things going on around you, like let's say you're in a relationship that you want to get out of. Let's say that there's someone that's sick who's close to you. Or maybe you have slept poorly for the last couple of nights because you have a newborn. Or you have a child that's not good, or that's not sleeping well. Well, all these will affect your ability to be resilient and to cope. And if you're not aware of how these things are affecting you, sometimes your focus can then really be on the pain and the intensity will increase massively. So you need to see what's actually affecting your resilience or your ability to cope. And you need to think, well, am I overreacting to this? Or is this a natural response? Is this a normal response? Have I more control over this response than I think? And it's nice, to be honest, to do this in a podcast form, because some people, when you look at the ego and you take that into account and you say to someone, are you coping well with it? Or is that a natural response, or are you over exaggerating that response? A lot of the time people will get very defensive on that. Obviously that's not how you would ask them, obviously, but they can get very defensive on that. But it's not that I'm attacking, or it's not that a practitioner is trying to attack you by any means. It's that they're trying to get to the bottom of whether or not there's other things that are contributing to this at the time. And doing this in podcast form, because I'm not talking to anybody individually here, I want you to get a better understanding that there is things that will affect your ability to cope. And I did a podcast with Dr. Cullum Doody, and we talked about this a lot. I did another one with Dr. Eric Kareem, and we talked about resilience and what affects your resilience. Resilience is your ability to bounce back from adversity. So when you are looking at coping, you need to just consider what else is contributing at the time. Are you doing too many things? Are you burning the candle from both ends? So is there certain things that you can take care of that will take the weight off so that you won't feel as under pressure to do things? And if that's the case, like, you'll often see it coming up to a big competition that things will start to flare up because there's a lot of pressure on them to perform. They want to go into this competition or a race, and the things start to kick up because they just feel like everything is coming down on them. There's a lot of pressure on them. Now, a lot of easy ways to fix that is just don't enter the competition. But that's not the best coping mechanism, because that's kind of moving away from the challenge as opposed to moving into it. And I would be a big believer of like doubling down and trying to move into the challenge and then take the other things off behind you. Whatever other things you can take care of. So that's coping. So you're looking at language you use, you're looking at the focus, what you're focusing on, and then just becoming a small bit more aware of how you're coping and what could be weighing down in you. Now, to move on after that one, what we want to look at, and this isn't an exhaustive list, I just want to cover a few things that have cropped up with clients over the last couple of months and things that we've gone through ourselves. Fear is another big one. Now, fear can be a difficult one to manage at times, because sometimes if people have had bad experiences or repeated bad experiences, they're obviously going to be a lot more fearful of things that happen to them. So you have like the fear of the unknown, fear of making it worse, fear of what's the worst thing that could happen. And a lot of the time we jump to that. And that's thought patterns. I will talk through that in a minute. But fear versus confidence is a huge one. And I think when you're alone and you're trying to take care of these things by yourself, it can be very difficult to do it, because you just feel like, are you doing the right things? Are you doing too much? Are you doing too little? Are you making it worse, as I said? Now, working with somebody can help give you that confidence back. Somebody who knows what they're doing can help, restore the confidence in your body. Otherwise, are like just ticking off certain things, setting functional goals, setting different goals and ticking them off. That's a great way of building confidence as well. But you need to make sure that you're not letting fear dictate your life or dictate the injury and the recovery time from the injury, because it can take over, and if it takes over, you're basically fighting two battles then as to what is what the actual issue is itself, as well as your fear of making it worse. Okay, so you need to try control it, and what some people say is they use it to their advantage. And a lot of high performers are excellent at this. A lot of fighters are excellent at this. Just a lot of high performers in many different disciplines are excellent at taking fear and using it to your advantage. And Mike Tyson said it as well. Someone said, "Are you not scared going into fights, or you're not fearful?" And he always said, "I was scared going into every fight." He said, but he was able to control it, and he was able to use that fear to his advantage. Because in a lot of situations, I know there's a big difference between fighting and rehabbing an injury, but in a lot of situations, if you reframe it and use it as nearly a challenge in some cases, that you can help build a lot of confidence, which will help you to overcome that fear. Now, I think with fear, what actually backs up to that is your thought patterns. Okay? And if you are likely to be pessimistic about things, you'll find that your thought patterns can spiral into this like negativity. And a lot of the time it happens, it's like unbeknownst to yourself. It's like you don't even notice yourself building on from one to the next to the next to the next, where you say, okay, I'm going to miss the next couple of trainings, I'm going to get dropped from the team, I'm going to miss the next game, and I'm never going to be able to perform as well as I could before. Like, that's actually that happens a lot, that people get into that. That's just one thing onto the next, onto the next, onto the next. And as they go down the line, you start to notice that you catastrophize, because as people in general, I don't know how to say this, we do in fact enjoy some bit of drama. And I think that's why drama is such a big thing on TV. And it's very easy to not be self-aware and not notice yourself catastrophizing and looking at the worst possible outcome. And this is a difficult one because everyone has had different lives, and what's happened before them can really play into this. And depending on what's happened in your life before this point can have a huge effect. But that doesn't mean it has to dictate you. You can still take control of that. So becoming a bit more mindful just about how one thought is playing into the next, and how you are you finishing with optimism, or are you finishing on a negative note? Is one thing, are you starting with one and making the next worse and the next worse and the next worse? Because if you are, that's going to have an effect on you. So it takes self-awareness to take control of this. And it takes mindfulness. So like practicing certain things like meditation, mindfulness meditation, journaling. Some people use breathing, it helps them a lot. Conscious breathing is a good one. Anything that will help you be more mindful will help you to notice when these thought patterns crop up and how one thing leads to the next. And it might be easier first to see it in other people, to just be more aware of how they lead one thing to the next, to the next, to the next. And not to be judgmental about it, but just be aware of it. And if you see it in other people, a lot of the time you'll see it in yourself a bit more as well. Or you could just take the other practice, work on the meditation side of things, work on the journaling, and see how these things crop up for you too. That's the thought pattern. So I guess really there's just two more I want to talk about. But what we've talked about so far is the language you use, where your focus is, how you're coping, as well as what's affecting your ability to cope, whether fear is dictating your injury, and are you controlling your fear? Are you using it to your advantage? And then the other one is thought patterns. Are you self-aware? Are you aware of how one thought is leading to the next, leading to the next? Are you catastrophizing? Are you making it out to be the worst possible thing it could be? Or are you looking at it and trying to be a small bit more optimistic about it? How do you do that? Just on the last, when you notice yourself thinking about something, try to finish on an optimistic note. And it can be something simple. Oh, this is getting worse, this isn't getting worse, this isn't getting worse. And then you notice that and you say, but with work, it'll get better. But once I keep putting in the work, I'll be able to get to the place that I want to be. Okay, so you have to just see how you can do it. And that, I guess that finishing on optimism goes back to the language you use and how you incorporate language into your daily life, and how you use different words and pick the words that you use when you're talking about specific things, especially your body. Now, the last two I'm going to talk about, and I'll talk about them individually, and then I'll try to join them together, is beliefs and attitudes. And it's something that you hear me say often on Instagram, on TikTok. I'm big on TikTok, but I'm putting more work into TikTok at the moment. What I think to say. But yeah, so beliefs is a huge one. Why do you feel something will turn out the way it does? So has it happened to you before, or has it happened to someone you know? Okay, what do you believe will happen if you push harder, or if you do less work? What do you believe the outcome will be in that case? Or what do you believe has gone wrong so far, and what's contributing to that? And this belief, this is why MRIs are so dangerous, because an MRI can completely reshape your belief in 2 or 3 minutes after seeing the results of it, where you look at it and you say, okay, I have degenerative disc disease, so that's only going to get worse. I have arthritis, that's only going to get worse. I have, let's say, a bulging disc, so that's going to put a lot more pressure on my spinal cord, and now I'm going to get certain symptoms. Or I have a cartilage injury, and they're finding cartilage injuries in general are becoming more like grey hair. So I have a cartilage injury, and that's the cause. So these anatomical abnormalities very quickly become beliefs about what you can do and how you limit yourself. And there's an interesting, you've obviously heard of the placebo, and the placebo has a huge effect on a lot of things. But the nocebo is just as important as the placebo. And this is where MRIs come into it. and how when you talk to people and they give you a diagnosis, or when you talk to your consultant and or your doctor or your physio and they give you a diagnosis. And the nocebo effect is an interesting one. It's why when I'm working with someone, because I really only take people on long term unless I do like 1-to-1 consultations, I try to be very cautious in the diagnosis that I give people, and people want a diagnosis. There's a great quote. It's that someone without a diagnosis is naked to the public, where they feel like they don't know what's going wrong and this and that, and like they feel like they're naked to the public and that they're just in the eye and everyone can see them, and that they're false, or they're nearly a liar in the eyes of the public. Because surely if you had something wrong with you, you would have a diagnosis so that you could work on that. And in my case, when I'm working with people, I rarely give someone just one diagnosis and say, this is the problem. Because in nearly every case, that is never the case. Okay? Someone sprains an ankle, grand. Even ligament damage, it was acute. It happened on the pitch. There was a mechanism of injury. You can see what happened. Okay. Someone's knee starts to kick up out of nowhere, or someone's hip starts to kick up out of nowhere. That's completely different. And if I can give you a diagnosis for that, you will connect to that. So much so that I often see people come to me with something like flat feet. And now the reason that because they have flat feet is contributing to everything else. That's the reason they have back pain, hip pain, everything. But the flat feet didn't just come out overnight. Like you've had flat feet for your entire life, so surely your body would have adapted to it the same as it adapts to you putting a barbell on your back when you go for a squat. And the first time it's sore, but it's not as bad after that. Do you know, the first time you start doing step-ups, the first time you start sprinting, or the first time you start a new sport, the body adapts to it over time. So why in this case has it not adapted? That's why with diagnoses that are mechanical based, I rarely just give you one specific thing, because what I try to do is I try to give my clients a different perspective on what could be contributing. Now, I will generally say it could be this one, but then it also could be this, and this. And most likely this is contributing to the pain that you're feeling. Okay, because generally I know them, as I said, I'm with them long term, so I get to know them and their lifestyles and kind of their lives. So it helps a lot to be able to do that and be able to connect these things together. But I could just say, you have that because you have a hip ache. You have that because you have scoliosis. You have that because you have rounded shoulders. Okay, you have a forward neck posture. That's why you have neck pain. Yet, nearly every single person in the Western world has a forward neck posture, but only a small percentage of them have neck pain. So please tell me how that relates. So obviously, that's anyway. Not to be going down that side. I hope that you get the point that I'm trying to make, is that generally an injury or an issue that kicks up is not just related to one specific thing. Sorry about that dog barking there, to pause the podcast for a second, because my dog was losing the run of himself outside, barking at other dogs. But to go back to it again, as I said, beliefs are so important because they have a huge effect. And the nocebo effect, to take the description straight from Google, no better place, an example of the nocebo effect is the severe adverse effects experienced by patients taking a placebo during a clinical trial. Some experts state that the nocebo effect may have a larger effect on clinical outcomes than the placebo effect, as negative perceptions are formed much faster than positive ones. So really what they're looking at is, even though in certain cases, let's say certain papers, they give somebody a sugar pill and they tell them that these could be the side effects of it, those people have the side effects, even though they were given a pill that was basically sugar, that is sugar. They're told these are the side effects that you're going to have from it, and their body reacts accordingly, because that's the way it is. Remember, it takes in all the information. So I want you to think about, what beliefs do you have that are affecting your progress? If you can get a better idea of that, like, what beliefs do you have? Do you believe that let's say your father had a bad back before him, so now you have a bad back, you're guaranteed one? Or that somebody else on the team tore a hamstring and they were out for 12 weeks, so now you're going to be out for 12 weeks? Like, these are really, really important that you take care of these things, because if you don't, you'll find that they will just root themselves in nice and deep in the subconscious, and they will just keep replaying over and over again, and they'll have a huge effect on your progress. So you need to be aware of them, and you need to work on them. And to finish on the last one, it's attitudes. Attitudes are huge. The attitude that you take towards it, and this really ties into the belief, and beliefs will dictate your attitudes a lot of the time. So that's why it's important to tie the two of them together. But the attitude that you have towards the injury, as I said, if someone took 12 weeks before and you believe that that was the case, so it's going to take you 12 weeks to rehab a hamstring injury, for the first 4 or 5 weeks, are you going to do that much with it? Because you know that, or you in your head that it's going to take 12 weeks anyway to get back, so there's no point really doing that much. You slowly but surely you'll creep in and you'll find yourself getting lazy about it, not doing the work, not putting it in, because there's a certain time frame that you have to follow anyway, so you're not going to be back before that. That's the thing. You need to be really, really careful with the attitude that you take to something, and that's why I really try to push an optimistic attitude when it comes to rehab, because you will get to the stage that you want to get to. It just takes time. The other thing is, when you look at, if you have a bad attitude towards, it could be a rehab plan, it could be a practitioner, you'll find that you won't commit and your adherence will be poor. And I often see this with people who come to me and they will say that they were with this person or that person and before, and they'll often knock the plan that the person gave them. But when you get into it, you'll find a lot of the time that the adherence is really poor. They had a bad relationship with them. So obviously that's going to dictate the attitude that you're going to have, and that's going to have a huge effect on the outcome that you're going to experience. You need to also, when you have an injury or when you have an issue, like a shoulder issue, okay, I keep coming back to that one, or a back or a hip issue, whichever one it is, when you go in, are you looking for a quick fix? Are you going to go in and say, okay, like not having a notion what's going on, yet go in there and say, right, I need a quick fix here. What is it? Because we all do this with everything, I'm sure. Go in, see what the quick fix is, what the quickest way out is, and take that. Yet only to come into contact with the same issue 3 months down the line and have to go in and look for a quick fix again, where you're not actually taking care of the underlying issues. So watch out. Are you looking for a quick fix, or are you committed to doing what you have to do to get it right? And that's the thing, is that these things, a lot of times take a lot longer, and a lot of times take shorter, like way less time than you would expect. But the attitude that you have going towards that will dictate it massively. So really, really be careful about the attitude that you take to someone before you go in to meet them towards the rehab plan, and make sure that you are actually committing to these things for the time frame that you're giving it, okay? And watch are you looking for quick fixes, because it's a dangerous game to play, because you will just continually look for quick fixes. And as I said, slowly but surely your beliefs will become more ingrained, because you look for a quick fix, it doesn't get fixed properly. You might have quick relief, but it doesn't get fixed properly, and it just keeps playing back. And then you start to use that language again of, oh, it's no good, I can't do this, I can't do that, or it gets worse. Then you'll start to focus on the wrong things as you go into it, and then obviously because the more times you go through it, your coping will get worse and worse, because your just ability to be resilient with something that keeps coming back will be a lot worse. Okay, so a quick run over all of them is, watch the language you use. Okay, you need to be mindful of it. You need to look, when you're focusing, you need to look at what you've done today, yesterday and the week before, and what functional improvements you have. When you're looking at your coping, you need to look at what's going on around you and what's affecting it, as well as can you take the weight off and give you a better chance to be more resilient. Fear versus confidence. Don't let fear dictate it. Reach out to someone if you need help with something, and then try to control fear and use it to your advantage. And the very last ones then is thought patterns. If you can catch your own thought patterns, if you can notice them in someone else, that you notice how one leads to the next and leads to the next, it can be easier for you to become more aware of yourself. Practicing mindfulness, journaling, things like that will help you become more aware of it. And just really be careful with catastrophizing, making it out to be as bad as it could possibly be. And then the last two, as you know, we're looking at beliefs and we're looking at attitudes. If you become aware of them, it's a lot easier to change them. So I guess a lot of this is about self-awareness. But hopefully after this podcast, you'll have more self-awareness, because you're going to be more, I guess, inclined to pick up on them. And if you can pick up on them, you will be surprised how fast you can make change. But that's all for me today, guys and girls. Hopefully you were able to take from that. I know it was a bit longer than most of my other podcasts, but I kind of wanted to go into detail, and I want to give you examples and case studies of different people that it has happened to, and I've seen it crop up with, these different things crop up with. If you take care of these, you'd be surprised with how quick you can make improvements. But guys, that's all from me today. If you want, you can scroll down to the information section of the description of this podcast. I have a free return to running program there. Click that, download it, and you'll get it, and you can just have it on your phone. It's a nice PDF. It's especially handy if you ever have a lower limb injury, or if you're getting back to sport and you want to just have like a nice and easy, I guess, lower limb program that will help you kind of reintegrate back into sport. Also, I would love if you could subscribe and rate this podcast on Spotify. You can rate them on Spotify now, which is really good, as well as on iTunes, and maybe leave a comment as well there. I would love if you could get in contact and let me know what you're thinking about the podcast, as well as any episodes that you would like me to cover or guests you'd like me to get on. I'm going to be reaching out to a lot more guests now over the next couple of weeks. But yeah, that's all from me today, guys. Hopefully you took a lot from that, and I will talk to you all again next week. Have a good one.